Good morning, everybody, and welcome to this iPlato Flu webinar today, Flu Invitation webinar. My name is Daniel, and I will be your trainer today. I'm going to take you through the ins and outs of sending out your Flu invites. Thank you for everyone for joining so promptly. It's lovely to see you all here. Now, you notice that when you've entered the webinar today, you've all come in on mute. Don't worry about that. That's to be expected. It's just so that our webinar moves as smoothly as possible for you. It's not because we don't want to hear from you, I promise. In fact, we have our web chatter today, Zoltan, and he will be able to chat to you as if you have any questions as we go through the webinar today. Just going to run through the slides that you may have already been seeing. We're in our agenda at the moment because we're doing the welcome and intro, of course, and I'll come back to this in a bit for you. But if you do want to ask a question, just wiggle your mouse on the screen there, and you'll see the toolbar pop up, and you'll be able to click there to access the chat. Now, very importantly, I would like to draw your attention to the slides that are currently coming up on the screen at the moment as well, because did you know that iPlato actually operates a number of regional flu reminder services across CCGs and STPs? Before you run your own local flu campaign, do check with your CCG in case they are using our centralized messaging service, the MyGP Engagement Hub. If you need any more information about the hub itself, you can always contact hub@iplato.com. And even if you are being serviced by your CCG through the hub, do stay on the webinar with us today and enjoy the session. Hopefully you gain lots of good things from it today as well. Now, as well as the chat function on the system, we do also have the ability to rename ourselves as well. And thank you to those who have already done so. For anyone else, what we would like you to do is simply click where it says Manage Participants on the little toolbar, and just pop in your full name for us there, just so we know where you've come from, so we can contact you later as well with feedback. If you have any feedback to give us, we'll send you a link for that after the webinar today as well. How to change your details on the system are up on the screen for you now. Click where it says Manage Participants and just update your name by clicking Rename. Can see a few more people are just joining as we come in. Thank you so much for joining us today. Lovely to have you all here. I hope you all have your cup of tea or coffee, the beverage of your choosing, to hand. You're all sitting comfortably, ready to enjoy the webinar today. You may be tempted when going through the webinar to maybe use your own system and build your campaign at the same time. I would very much like you to just put a pause on that and stick with me here and just focus on the screen and sit back and relax and enjoy the session so that you can apply what you learn to your flu invitations. For the last people joining there, thank you for joining. Welcome. My name is Daniel. My colleague Zoltan is your web chatter today. So if you have any questions, do feel free to wiggle your mouse, use the chat function, and ask a question. Any questions that you ask through the session, we will look to cover those at the end in our Q&A at the end of the session for you. And if you haven't already, please also just click on Manage Participants, hover over your name, or your email address or your username there, click rename, and just pop your actual name onto the chat there so that we can see where you're from and who you are. Okay, fantastic. So today we're just going through our welcome and intro at the moment, of course, and we're going to begin with our session shortly. So today we're focusing first of all on our welcome and intro there on our agenda. We're going to be moving momentarily to coding settings. Now, coding settings, by this I mean relevant clinical codes in your Connect system that will code back automatically that you've sent a text message to your patient. That's going to update your relevant patient care history or patient record, depending on your clinical system, automatically for you. So a lovely important section. We're going to start there. Once we've had a look at that, we're then going to go into our creating a group. Now that's a really important section, and I'm going to show you how to create a group, how to use patient ID numbers or NHS numbers to create that group, and the uses for different types of groups in terms of sending out messages to patients at different times. We'll then look at creating a template. So once we've done our group, we will then look at creating templates to use to send to our patients. And we can look at tailoring those templates as well, so that you can send messages to a particular group and then create a new message to send to a different group so that you can target those. We'll then look at activating a campaign. Now, just like a patient can respond with the word cancel for an appointment reminder, you can actually program your system to be connected to connect a clinical code to a particular trigger word, and the patient can respond with that trigger word so that the relevant code updates your patient care history automatically as well. So we will have a look at that today. Once we've done that, we will then put all of those pieces together and send out the flu message. We'll show you how to put those pieces together and also schedule when those go so that you can stagger your groups so that they can be sent out in a timely fashion and not perhaps all at once, for example. We'll then show you the help section at the end of the webinar today. We have a fabulous help section for you all for flu season, which is going to take you through the steps of sending out a flu campaign for you. And I will cover off a few things in there at the end. So if you have any questions about the help section, do hold those to the very, very end there. Finally, we'll have some time for a live Q&A session at the end, which will be led by my colleague Zoltan. So he'll come at the end of the session and run through the questions that you may have had on the system through the chat as we go. Okay, fantastic. Well, I think everyone has joined. We are ready to proceed. So let's go to the first step on our agenda today, which will be coding settings. To do that, we're going to need to get to our Connect system. So the first thing I'm going to do is move us across to our Connect system. And on the screen, we're going to see our login section. So we're going to log straight in. And we have all of our favorite lovely friendly Connect system here on the screen. As you can see, we're in our trainer demo site today. If you were in your own site, you would see your practice name at the top here. As you can tell, we land on the summary page anytime we log in. So just before we check on our coding settings, it's worth just checking off a couple of pieces of information on your home summary page, specifically your credit balance and last replication. Now, credit balance is an important one. It's showing 0 on my screen here on the demo site. It may show that for yourselves, or it might have a number there for the number of credits you have. This is going to be dependent on how you're funded for your system. If you are solo site or you pay at the end of the month, then your balance is going to say 0 there, so that would be to be expected. If you're funded by your CCG, you're going to have a number there letting you know how many credits that you have available, and 1 credit equals 1 text message to send. So it's a really useful place to start because you can have a quick look and check whether or not you have the credits available in order to send out your flu invitation. If anyone is in any way unsure about how you're funded or about how to top up credits, do contact your CCG or your iPlato account manager. Last replication, also really important. We can see that it's showing today's date. That's exactly what we want to see because it's letting you know the last time that your Connect system and your clinical system synced up together. So if that ever lagged behind, we would need you to contact our support team, and I'll show you how to contact them at the end of the session as well. But if it shows today's date, it's showing exactly what you want to see there. Below that, we have some tables of information which show your text message and MyGP data message traffic. Again, it's a test site here, so we're seeing a number of zeros. For yourselves, you may see some traffic there. That'll let you know how the messages are going out. Okay, fantastic. So we've checked our summary page. Let's get into the first part of our agenda today, which was to check those all-important coding settings. So they are found under our settings menu, and that sits on the left-hand side at the bottom here. And under our settings menu, we're looking for read code. On the screen, we'll see a number of read codes here, clinical codes that will go back to the system. On our test site here, we're using read codes related to EMIS. For if you're using other systems, System 1, then you will see your own relevant clinical code here. Now, the great thing about this is these are all automated to program back into your patient care records straight away when a patient either is being sent a message or when one is received. Today, the important ones we need to check are here, SMS out manual for when you send a manual health campaign, and SMS in. For SMS out manual, we can see we have a particular code here and that this is switched on. So when we send out a text message to our patients, that relevant code is going to go back for your EMIS users to your patient care history. For System 1 and Vision users, that's going to go to your patient record and update that information that you've sent to text automatically. We have SMS in, which has a slightly different code there, and it works exactly the same way, but it's in reverse. So as soon as a patient responds to your health campaign, perhaps with a chosen trigger word, the fact that they have responded will go to your patient care history again for EMIS or patient record for Journal System 1 and Vision to update that you have received a text. So we need to come here, just make sure these are switched on. If anyone has moved to SNOMED codes, we are fully compatible with SNOMED codes. If you do need to move your system to SNOMED codes, simply contact our support team. They can be found at help@iplato.com, and my colleague Zoltan will pop that email in the chat. So even though it's a simple one, you don't have to remember it. Don't worry, we've got you covered. Okay, so we've checked our settings, we've had a look, we can see that they're on, and we've checked that they're the relevant codes that we want to have going back to our patient records. So we are ready to begin sending our health campaign. Now, the first step of actually any health campaign that you do, including the flu invite, is going to be in your own clinical system. You will need to run a search for the patients that you would like to target. You will then need to export those patients onto either an Excel spreadsheet or a .csv file. Now, in true Blue Peter fashion, I have one that I prepared earlier. And here we go. This is our pretend list of patients that we're going to message today. Now, you can see my list is relatively short for our example today. When sending out your flu campaign, you may well have many, many more there, hundreds, perhaps even thousands possibly. In terms of creating a group, what we need for Vision and EMIS users is the patient ID. So as long as you have on your spreadsheet the patient ID column, you are all set to go. For System 1 users, we work with the NHS number. So when you export your list, as long as you have the NHS number in your column, and it's been formatted the same way that you can see here, so no spaces in the NHS number, you are then also in the right place and ready to go. I'm going to select the column of patient IDs, and I'm going to copy it. Okay, I am ready to create my group in the Connect system. So first thing to do, let's come back to our Connect system. And we're going to the Campaigns menu, two up from the settings there, and we're going to Groups. On the screen, we can see a number of different groups here. Some have been created as an example for us today. We have the group name on the left-hand side, when it was created or last changed in the middle. The group type being patients, and then members is the number of patients in those groups for you. The top two here, single numbers and duplicate numbers, these are created by default when we set you up on your Connect system. If you do want those updated, again, contact our support team using their email. Below, though, we can see we've got a few different examples for a flu invitation and how you might want to break up those patients that you're messaging. So I can see here we've got our flu invite over 65 group, a general group of flu invitations, and also an at-risk group, in this case, pregnant. So you can be really specific with your group and label them accordingly. Now, our group obviously is just small examples. We can see they only have just the 8 members there. Let's pretend for a second that we have a large group. So our over 65s group, we've got a lot of patients we want to message, but we actually want to message them over a couple of days. We don't want to message that many people all in one go. So what we can do is we can create a group in order to break up that list. And to create any group, the first place, as the eagle-eyed amongst you may have spotted, is create group at the top here. So we're just going to click here. And the first thing we get to do is name our group. So if you haven't yet created a group accordingly, you can then name it whatever you would like it to be. It can be specific to the search that you've run. For my example today, I'm going to pretend that I need a second over 65s flu invite group. This is where the pressure of typing live is tricky. Group type we leave as patients, because it's patients we're messaging today, and then we click Add Recipients. And we get taken to our Edit Group box. So here we can now search for our patients. If we're creating a relatively small group, we can do that by actually searching by name in the recipients box here. However, we've made things nice and simple for ourselves, particularly with large groups. So we're going to use this box down the bottom. Now for your EMIS and Vision users, you would leave it in patient IDs, as it's patient IDs we'll use for those systems. For System 1 users, we need to just change that to patient NHS numbers. So before pasting in, just make sure it's patient NHS numbers for your System 1 users. I'm going to leave it on patient IDs, as it's the IDs I've copied, and I'm going to paste them into that box at the bottom. Now, don't worry when you paste that you can't see all the numbers. That's absolutely fine, because what we need to do is get them to the right-hand side. So I'm going to do that by clicking the little blue button here. And that moves my patients across to the right-hand side. So you may be thinking to me, Daniel, that's great. I'm ready to go. Let's press save. But let's just pause a second, because you may have spotted that new button appearing saying excluded. Now, if I click on that, my list is going to disappear, just like that. That is because the list that I've taken, I know all have mobile numbers. When you run the search in your own clinical systems, you're bound to pick up a few patients who haven't been registered with a mobile. When that happens, when you click excluded, your system is going to show you that list of people here. So if you do want to message them another way, you can simply highlight and copy their information, and maybe save them in the spreadsheet, for example, for safekeeping, and then you can message them another way, letter, email, whatever it might be. If we click included, our list will return. We've checked our excluded patients that don't have a mobile. We're ready to now save that group. So I'm going to click save here. And we can now see that group at the bottom of the page. So again, the name on the left, when it was created, and how many patients. Now that date in the middle, when it was created, that's a really important date and always worth checking, particularly for something like your flu invites, where you may be re-inviting people over the coming months, because these groups are static. They won't change until you edit them or change them or delete them. So when you come to resend a group, have a quick check. How long ago was it created? Is it a few days, weeks ago? Is it worth rerunning my search and updating my group? You can do that by clicking the edit button on the right-hand side, or if it's easier, just simply deleting the group and starting again. If you do need to edit the group at all, you can click into edit and update by pasting in more, new IDs. But you also have this function here, export to Excel. That would export the group into an Excel spreadsheet for you, and would actually show you those patients who have been opted out of receiving text messages as well for you. I'm just going to click cancel off my box here. So we can see how we can create our groups, name them nice and specific so it's clear who we're messaging, and we can look at breaking up large groups as well. Now, if you do want to send something in a very large group all in one go, just get it all done, then you can do. You can actually send a message, you can actually create a group, up to 6,000 members in one go. So if you do want to do it that way, you can, but you can look at breaking them up using multiple groups like I have here with my over 65s, so that I can send them at particular times. And I'll show you how to do that when we come to send the message. Okay, brilliant. We've created our group. Let's now create our template. So we're going to go to group campaigns again on the left-hand side, and we're going to templates. On the screen, we can see again some examples. All our templates are listed by subject. So we can see our flu invites are at the top here in alphabetical order. We can see we've got a couple of examples. So this is what I was saying from the beginning of the session, for those of you who remember, talking about tailoring your messages to the groups that you're sending to. So I have a standard invitation, but I also have one for a pregnant group. Now, we do have some templates that you can use. This is in our help section. I will show you where those are at the end of the call for you. On the screen, we have the template itself, and just drawing your attention to how it's structured, we have our surgery name at the front here. The reason we do that is to grab patient attention. When that text comes through, we want that surgery name at the front so that it grabs the patient attention. They think, oh, I'm going to click into that one, and hopefully respond promptly to your campaign. It's up to yourselves how you'd like to structure it, but that's our suggestion there for you. We then have dear first name, and we have a mail merge term here. For those of you not familiar with mail merge terms, That's an automatic thing there. That's going to go straight to the first name of the patients in your group and fill that in automatically for you on your template. We will then have the main body of the text. And in this case, we're asking them to call to book an appointment or to text decline to refuse. Now, this is one of our all-important trigger words, and that is what we're going to be coming to on our next step. So this is the word in capitals here, so it's nice and clear. This is what we want the patient to reply with if we want them to decline this particular flu invitation. Now, right now, this is just a piece of text. It won't mean anything to the system until we assign it a clinical code. So everyone keep that in your mind. We're going to be coming back to that in just a moment. Now, the first thing we can have a look at doing here is editing our template. When we set you up on your Connect systems, by default, you'll have a flu invitation example already here, and that's for you to use, edit, amend, or even if you have deleted to your wishes. If you then want to put a new one back in, you can do. And if you want to amend what's there, all we need to do is click on our little edit button on the right-hand side. We can see that one here. So if, for example, our practice number has changed, we can pop in and amend the number accordingly. Now, when you make your changes, you'll notice that you'll have a character count at the bottom here. This is really important, and it will show up anytime that you're writing a text message. The reason being is that the single text message has a maximum of 160 characters in length. Anything shorter than that will go as one message and therefore cost one of those credits to send that you remember from your home summary screen at the beginning. Now, if you do need it to, your system can absolutely send longer messages if you need it to. It's just to be aware that as soon as you go over that 160 limit, that will go as more than one message and therefore cost more than one credit to send. And my colleague Zoltan will pop the limit on the chat for you as well. Once you're happy with your with your template there, let's click Save, and that's going to update that template for me. Fantastic. Okay, so I've been doing an example based on an over 65 flu invite. I don't yet have a template for that one, but let's say I want to create one. Now it's going to be similar to the one I already have, and maybe I've got one on the templates to show you later, but I'm going to do an example here of how you can create one off one that's already on your system. Using my mouse, I'm just going to highlight and copy that text, and then I'm going to go straight to Create Template. The first thing you'll notice is that you can select a subject. Now, if you have an invitation, a template that is similar to something that already exists and you want to file it together, you can ask the system to do so by selecting a relevant subject. I'm going to create a new one because I want it really clear when I put the message together which template is going with which group. So I'm going to click Add New Subject. And I'm going to say who this is for. I'm then going to paste in the template that I've copied. And as you can see, when it gets copied in, the character count is immediately updated for you. So I've copied in my template, it's ready to use, but I'm going to amend it to work for my over 65s. So I might want to put an extra line in or change some of the wording. Just for my example today, I'm just going to leave everything as is. And I'm just going to press save so you can see the new template on the system. And there it is. Again, filed alphabetically. Now it's listed ready for you to use. Okay, fantastic. So we have created our template. We've had a look at editing ones that are there, creating new ones, and actually writing in a trigger word as well if we need to, in this case, the word decline. And what we need to do now is actually activate that campaign. So we're going to go to our next step, and that is under the campaigns menu and under trigger words. On the screen, we can see a couple of examples already here for us. So we have a flu campaign, the clinical code that it's going to be sending back to you, either your patient care history for EMIS or patient record for Vision and System 1, and the trigger word that it's going to be connected to. Now we can see on this example that it's actually in a red status there. Now that's a really helpful example for me here because it can show you that even if someone texts the word decline back right now, nothing would actually happen because it's in a red status. So if you have a flu campaign already there, to activate that campaign, all you need to do our friendly little edit button on the right hand side here. We're going to click here. We're going to go straight to end date, and we're going to put that into the future and click save. And there we go, it's gone green. So now we have activated our trigger word, it's gone green. So when the system receives that word decline, the relevant clinical code that is entered will go back to your patient histories and update that for you. Now, what you can see on the screen here is our example code for today. Please do check in your own clinical systems, first of all, the code that you would like to use for a trigger word so that you have exactly the one you want to use for your own campaigns. Now we can see another example code underneath. For that example, that's for an over 65 flu invite, and it's just an example to show you the use of a different trigger word. So here we've got the use of the word refuse. Now you may be saying, well, why have you got a different trigger word there? Well, the reason being is that when running a health campaign, if you happen to be running multiple ones, for example, not just the flu at the same time, but other ones as well, it's to let you know that you cannot use the same trigger word connected to the same read code for two campaigns running at the same time. So just to show you that you can have a different unique trigger word, such as the word refuse or possibly reject, for example. If you do want to add a new trigger word, because you don't have one here to activate, then we simply go to add new at the top. And we then get to fill out our form here to create our campaign. So the campaign name, we already have our flu version there, and we've got one specifically for over 65s. Let's create a new one, for example, for a flu campaign for a pregnant group. So let's add in our trigger word. The trigger word we suggest putting in capitals here. Just so that it's nice and clear for you on your system. When a patient responds with the trigger word, it won't actually matter to the system if it's upper or lowercase. The system will read that word and send the relevant code back to your patient care histories or your patient records. But just so it's nice and clear for your patients and for yourself, we suggest putting it in capitals here. We then need to pop in the relevant read code. Now, again, when searching your clinical system, find the relevant read code you want to use. You can then start typing that. Beg your pardon, bad mouse work from me there. Let's move down. There we go. We can then start typing in the relevant clinical code. And as you do, you will start seeing that options will start coming up for you. When you find the one that you want to use, you can select it. And that's then going to populate the read code term automatically for you below. You then choose your end date, and then you'll be able to save. Now, I've just used the same word decline that's already in an active campaign, so you notice that the save button is grayed out, so the system won't actually let you activate two campaigns with the same trigger word at the same time using the same code. So just for an example purpose, I'm going to say reject, and now I can save. Okay, we've now created our campaign. We've activated a trigger word. So when checking out your trigger words, do check your clinical code that you want to use, the word that you want to use and that it's not already being used elsewhere, and setting your end date on your campaign. Now that's a really important thing with the end date. I've used today's date as an example for you, but when setting the end date for your campaign, do allow up to a couple of weeks or so, or even a month in advance. You are likely to get most of your responses in the first 48 to 72 hours, but you're also likely to get those people who read the message and then perhaps like myself go, oh yeah, I'll respond to that later. And then it sits in the pocket and they come back to it in a couple of weeks' time. So set your end date in advance. If you want to tie in one code to one trigger word forever and a day, you could set that as far advanced as you like, 2025, 2030, however far in advance you want to go, or however far in advance you want to click on the calendar. Okay, we have created our group. We have created a template. We've also activated a campaign to use in this example. All we're going to do now is put it all together and send out that campaign. So I'm going to click on campaigns on the left, and we're going to the top there, new message. The first step we go to, step 1, select recipients. This is going to look very similar to your edit group because it works in exactly the same way. If you're sending out a manual message and perhaps just a one-off message to a patient, you can look them up individually. But we've made life simple for ourselves because we've got a lot of patients to message. We've got our groups down here at the bottom. So let's have a look. Yep, I can find my groups. So I created my over 65 group today. I want to send to them. We select them, move them across to the right-hand side, and we can see the patient list updating. Now on the recipients box, if you do notice that the number is a little bit less than your group, don't panic about that. That's absolutely fine and to be expected. The system is removing, for example, those duplicated numbers or perhaps those people who have been opted out of receiving text messages. Once your patients are on the right-hand side, let's click Next. And we have step 2, create message. Now again, if we are sending just a one-off message, we can quickly click into the message box and start typing our message accordingly. But we've made things nice and simple for ourselves. We've created our templates, and you can spot those on the left-hand side here. Now, you may have already figured out that the bold headings there are the subject headers of our templates. So you can't click on those. We need to click the text below. So you find the template that you've written. So I've made it nice and clear for myself, flu invite over 65. I select my text and I move it to the right-hand side. Now, the eagle-eyed amongst you may have also spotted attached surgery details to message. If you do this, it will add a link to your message, which will provide some basic details about your surgery, opening times, and location. However, that link will count to the length of your text. So if you are a bit close to that 160 limit, you may not want to add that link because then you might go over and then that might go as 2 messages. I'm happy that my surgery name is front and center on the text, so I'm happy to leave that off on my example. Let's click Next. And we come to step 3, sending options. Now, the first thing we get to do is schedule when the message goes. So this is what I was referring to earlier, being able to time when certain groups go out so that you can stagger them so they don't all get their message on Monday morning and then all the calls come in on Monday morning alongside everything else. So we can help control that for you and manage those calls coming in to book those flu jabs. If it is to go straight away, just leave it as send now. That's absolutely fine. But I'm going to click send later because I would like this group to not go until next week. So I'm going to pop that in. And I'm going to say I'd like it to go well after the morning rush. So this text message is going to go at about 3 in the afternoon. Now have a look there. It is in 24-hour clock. So do be careful when scheduling the time your message is to go. If you did put 03, for example, you're going to wake a few people up. And whilst you might take some pleasure in that one, then you don't want to wake up everybody all in one go. So let's change that back to 3 o'clock in the afternoon. And my message is now set and ready. Now, the next step is to add a read code. Now, with the read code here, the clinical code, you can actually add a code to the message itself. So as well as being able to code back a patient response if they use a trigger word, when we send out our health campaign with our flu invitation here, we can actually attach a message itself to a clinical code, which will then go back and update your patient care histories for EMIS users or your patient records for Vision and System 1. So I'm going to click Add, and I get to add a read code in exactly the same way. Again, I'm just going to use an example on the screen. Please check in your clinical system which code you would like to use. But as soon as you start typing, you get to pick which one you are using, and it's going to populate the code, the term below. Here we also get to add a comment to our code. So if you want to say that it's been sent via SMS or sent via MyGP Connect system, you can actually type that in free text, and that's going to go back to your patient records with your chosen clinical code. Again, if you are on SNOMED, we are fully SNOMED compatible, so you will be able to type in the relevant SNOMED code and it will work in exactly the same way for you. I'm going to click Save and move on to our last step here, reply email. Now, with any health campaign you send out, the system would like to keep you apprised of any responses to your campaign. Now, we're going to be able to see where responses will go in the Messages tab, But what your system will also do for you is it's going to take a patient response if they respond, for example, with your trigger word. It's going to take that text message, it's going to turn that into an email and send it through to an email address of your choosing. Now, I should stress that patients will not see the email address. This is all done automatically for you. And initially, it will default to the user on the system. So if you want to change where that goes, we need to click the button saying change. We can see it's defaulting to the dummy user on the system. So we just simply click custom email list, add in the email address that we would like it to go to, click the little plus button, and once it's in the custom email list below, we're ready to save, and that's now going to go to that chosen email address for me. Once we've ticked that one off and we've scheduled our time, added our code, and changed the email, we're ready to send by pressing confirm to send. So I'm going to click here for you, because what we get first of all is a lovely, very important box here, message confirmation summary. Now, this is a great point at which to just take a pause and have a look through and double check what you're sending, because you may have started from scratch. You've done a whole new search for your system, for your group. You've done a whole new template and maybe activated a trigger word. So let's have a look through, just check off everything on the list. So we can see our message at the top. We can see how many characters it is, how many people it's going to, and the system will estimate the number of messages to go. It will also then let you know how many credits you're using. Now, this is another great point at which to pause if you haven't checked on your home summary page. Again, depending on if you are solo site or pay at the end of the month, then your credit balance may well say 0 with a minus figure afterwards, and you would be okay. You can proceed to send. If you are funded by your CCG and that credit balance goes from a plus figure into a minus figure after sending, please at that point click cancel and double check with your CCG about your credit balance and top up if necessary. After you've done that, you can check your delivery time, the default code we saw right at the beginning, if you remember all the way back to our coding settings, the custom code we've just put in, and the email we've just put in as well. If you want a copy of this, tick this box here, and an email copy of this will be sent through to your email address, so you can keep a record of everything you send out. It is at this point that if we are happy with everything we see, we click send. System lets us know, message is sent, we click OK, and that's now ready to go to our Outbox, and that's going to sit there ready to go for when I want it to be sent. Okay, fantastic. So we've now sent our message. Let's have a look at where that is on your system. If we go to the messages box just above campaigns there, I'm going to click on messages. We can see it's laid out very much like an email inbox there. So inbox, outbox, and sent box, but it's for your text messages. Now I've scheduled this to go later, so I'm going to go to my outbox. And we can see the groups that it's being sent to there. We can see that it says multiple recipients, so particularly if you are sending a larger group, it won't just flood this page for you. There's a nice short entry for you. If you do need to see everybody that it's being sent to, you can click here and it's going to bring that list up for you. Importantly, before its scheduled time, whilst the message is still in the outbox, you can edit your message if you need to. You can also delete it as well by selecting it and using the delete button at the bottom. But if you're to use either of those functions, please do that at least an hour before the scheduled send time. Once the message is gone, if we click on set messages there and click on sent, it would end up in here for you. We can see a few different examples here of individual messages having been sent, but also multiple recipients at the bottom. For any replies, you're going to find that in the inbox. Here we can see an example of a patient responding with a trigger word. They've responded lowercase, as I mentioned, system still reads that, still updates with the relevant clinical code to your patient records automatically for you. Okay, fantastic. So there we go. We've created a health campaign. We've sent out our message and we've checked our messaging boxes as well. So you may be thinking, great, that's fantastic. But some of you may be looking at me going, but I saw a different menu option under campaigns there, Dan. What was that one all about? Very well spotted to those who did. If I click on campaigns on the left-hand side, everyone should be able to see call recall at the bottom here. Now, this is a lovely little sending function for you, which can help those practices who have patients using the MyGP app. Now, the first benefit of the app itself is that when you send out your health campaign, anybody using the app will get their health campaign message sent to them via the app. That goes as a data message, and that goes for free. It doesn't cost any credits to send. With Call Recall, you can target those users specifically. So I'm going to click on Add New here. And we can see that step 1, select campaign recipients. Just like in sending a new message or creating a group, we can paste in our patient IDs for EMIS and Vision or NHS numbers for System 1. And they're going to be able to then copy those across to our patient list on the recipients list on the right-hand side here. And we can even export our excluded patients if needed. We then go to step 2. Step 2, create message. So we have 2 boxes now, one for MyGP users, one for patients who maybe haven't downloaded it yet. In the text message on the right-hand side, for those non-MyGP users, you can put a message very similar to the health invite that you would be sending out anyway, and you can even put the trigger word in there as well. For the data message, you can actually put in details in here as long as you like, because with a data message, there's no limit on characters. But you can also tell your patients, if you'd like to book for a flu jab, book in through the MyGP app. We can actually help save a phone call coming into your practice to book those flu jabs. They can do it all through the MyGP app. If I scroll down slightly, we'll see step 3, select a session type, and this is how we get the patients to be able to do this. We can see a mirror of the slot types available. Now, for this particular function for Call Recall, you may want to actually create a slot type for this very purpose. I've got one pre-prepared, just Blue Peter style, of course, which is the flu vaccination. We can select that type, and in the button call to action, I'm going to call it flu jab. This is what will appear in the patient's MyGP app. In order to make that appear, we need to give the button a time to start and end. So I'm going to ask it to start from today, and it's going to end in a week's time for me. So I've now set the time frame that this button will appear in the MyGP app. It's only going to appear for those patients that I've messaged. It doesn't appear for anybody else using the MyGP app. That's the clever part of this for you. And then everything else is very much just like you did with a health campaign. You schedule when you'd like your message to go, you schedule the time, you can add your read code, and then you do your confirm to send and double check your message before it goes. When that goes out, anyone not using MyGP gets the standard text message that you entered here. Data message users get the MyGP app to the MyGP app will get that data message letting them know that they can book directly through the app through your chosen slot type. There we go. That's the option for Call Recall for you as well. This is bringing us nicely towards the end of our webinar today. I'm going to show you the Help tab, and then we're going to be able to go through your questions as well. In the top right-hand corner, you'll see the Help button. It sits there all the time, no matter what screen on the Connect system that you happen to be on. So if I move to the home summary page, you can see we still have Help. I'm going to click here for you. And then right at the top, seasonal flu campaign. So I'm going to click into here. And here we have our flu campaign help section. A reminder at the top, before you start, just as I mentioned at the beginning of the webinar, we have our engagement hub helping CCGs and STPs deliver bulk messaging for flu campaigns. So do check with your CCG or STP before doing your own localized message. We then have some help for you, including preparation. We have a pre-checklist. So before sending out your flu invite, things to do to help you do that nice and smoothly. We also have those examples. So in here, you'll have the template examples that I mentioned before that you're able to simply copy and paste and then edit to your heart's content in your Connect system. And we also have a guide on variable fields. So the variable field I mentioned earlier about filling in a first name, there's some more information in there about other ones you can use. You then have your step-by-step guide. So taking you through everything I've taken you through today, one after another with instructions and videos. So everything you need is here, including a section on Call Recall as well. Now, if anyone does want to enjoy another webinar, if you haven't quite had enough of my voice and you'd like to hear me again, then do click into the webinar hub page and you can book into a new webinar if you wish. There is also a saved recorded webinar there as well. So if you want to rewatch in your own time, you can use that one in there. And then at the bottom, we have the post-invite checklist. So things that you can do after you've sent your message to help get the most from your campaign. Again, if you have any problems, then you can check our support team as well. Their details are in there, including that email that my colleague Zoltan pasted in earlier for you, help@iplato.com. Okay, fantastic. Well, that brings us to the end of the help section here. So all that remains now is our Q&A section. Now, I know a few of you have asked questions, so I'm going to hand over to my colleague Zoltan now, who's going to run through those questions with you, and then he'll hand back to me just to end the session. So Zoltan, over to you.
Hi, good afternoon, everybody. I would like to say thank you very much to joining our Flu webinar today. My colleague Dania covered a lot of useful information, but just in case, if you do have any question, please feel free, wiggle your mouse and click on the chat functionality. You can send a message to the group or you can send a private message to me. For those practices who does not have any question, feel like they got everything they was looking for, feel free to go back to your day. But before you're going to do that, we kindly ask you that after this session, we're going to send an email which contain the feedback. So if you could leave feedback on us, how we did today, that would be much appreciated. But just in case, I will add a link into our chat as well. You can click on the link as well, and you can leave a feedback on us. At the moment, we have not any question about the session, but just in case, we're still on the line, if feel free and just drop a message to us. Just look at the chat if we have any question. Okay, I can see nicely Daniel covered a lot of information, but again, if you feel something is missed, please feel free, wiggle your mouse and send a message to us. Anybody who's got all the information you was looking for, feel free to go back to your day. And thank you very much for joining our webinar today. Okay, don't forget, if it's possible, please leave feedback on us, how we did today. That would be much appreciated. Looks like, Daniel, you covered a lot of useful information today. Our chat is quite silent.
Indeed, Zoltan. Thank you very much for covering those points there, and thank you everybody for attending. Just something else whilst some people are still here, if you are just forming a question in your mind and you want to ask it, I'll give you the chance to do that now, because I know typing is not always my strong suit either, so don't worry, type away, we'll answer shortly. But one of the other reasons for creating multiple groups, for example, as well as helping staggering how many messages might go out, particularly if you have a large group, is to help time it so that you can maximize the response when it comes in. So for example, if you know that you don't normally get a lot of calls on a Thursday afternoon and most of your reception staff are there and available to answer those calls, you can schedule it to go at that sort of time so that you can have the best response, so that you can get as many people answered and booked into a Flu invite as soon as possible. So I just wanted to mention that. Something else to mention about the call recall for you as well, because some of you may have used it before. But for those who haven't, and for those that have, I would like to let you know that you are actually able to send multiple call recall campaigns at one time. So you can send out to your flu invites, but then if you did want to do a call recall for your asthma reviews or diabetic reviews at the same time, you would use the same process, and they can book in, and you can have those run at the same time. I don't think there was anything else to cover today. I hope everyone got everything that they needed from it. Um, I hope you got all the points that you needed. I think people are just leaving now to go get their well-earned cup of tea or begin their lunch break. Um, any final questions from anybody? If you have any final questions, do feel free to pop those in the chat, or if you would just like to say thanks so much and give us a thumbs up, whatever it might be, do feel free to ask. I think it's just one person left. If you would like to ask a question, we're available for the next few minutes here, so please do ask.
Nicola, if you have any question, anything would you like to double check, maybe something was not clear enough about the session, just please feel free, wiggle your mouse and you can send a message to us. And we would like ask again kindly if you could leave feedback on us today, how we did, that would be much appreciated. The link added on chat as well, and we will send out via email.
Thank you very much, Zoltan. No, that's absolutely perfect. Thank you so much indeed. Thank you everybody for attending today. It's been my pleasure to take you through our flu invitation webinar today. My name's Daniel, and hopefully we will see you again. Thank you so much, and goodbye and good afternoon, everybody.